Guys, welcome back to Milk Mummies, the podcast where we have honest conversations about motherhood, identity, and ambition. Today's episode is such an important one. I'm joined by Dr Nagla Elfaki, a fertility and reproductive medicine doctor who is passionate about making women's health information more accessible. We're talking about all things motherhood, fertility, timing, ambition, and some of the truths that women don't always hear early enough. Let's get into it. Nagla, hi. How are you?
I'm fine, thank you. Yeah. I'm good. How are you?
I'm very, very well. Husky is the vibe today, so forgive me, everyone. But that's me. But yeah, thank you so much for coming down and giving up your time to talk about all things motherhood, fertility, all that jazz. So I'm really looking forward to getting into it.
Thank you for having me.
No worries at all. I guess jumping into it, can you take me back, I guess, to what drew you into medicine and then specifically into fertility?
Yeah, okay. So I think as a child, I probably just said, I wanted to be a doctor because I think that's what adults like hearing. They're like, okay, great. But actually, as I got older, I realised I really like the science aspect of it, but it's also the human connection and like talking to people and things. And so I went to medical school at 18 and kind of enjoyed everything. But then when I had my first placement on the labour ward, I was like, oh, okay. It's really exciting, right?
Okay, I was going to ask you, was it shocking or what was that? Okay.
Yeah, well, I think it's a bit of like awe.
Okay.
Because,
amazing.
Being pregnant or having a baby is not an illness, it's a normal part of life. And for most people, it's, one of the happiest days of their life.
Yeah, that's true.
But I was thinking as a medical student, you kind of get to be a part of this every day, which is amazing.
Yeah.
And then beyond that, I also had an attachment in an IVF clinic where I saw somebody who was really young, like under 30, who had one child. She was single. She was having her eggs frozen because she was going through treatment for breast cancer.
Okay.
And my consultant at the time was explaining to me that, the treatment that she was going to have could affect her chance of being able to have a baby in the future. And I was like, okay, I didn't even realize this as a medical student. So then we kind of started doing a little bit of work about fertility preservation, which now is much more mainstream in terms of like social egg freezing and things like that. But that's what sparked my interest in the fertility side of obs and gynae.
Okay, I see. Okay, that's really cool. I guess, I'm trying to think of anyone that I know who's a doctor. I don't know if I've ever asked them what drew them into medicine. Yeah. And the reason why I'm saying that is because it was actually quite refreshing or quite cool to hear you say that it was also exciting and just you wanted to have that connection to people, or you saw that being a thing and you wanted to be a part of this. That's quite nice to hear, like a real human reason as to why you want to go into medicine, if that makes sense.
Yeah.
I guess maybe taking it back a little bit, I suppose. Who were you before motherhood and like before this career path fully took shape? What did that look like for you?
Yeah. So in terms of my background, I'm originally from Sudan. I was born there actually, but I've grown up in East London from a very young age. So I feel, British in that sense and a Londoner. But before motherhood, I had a really great time. I feel like I was a single woman for most of my 20s. Yeah. I worked hard. I had the opportunity to do a lot of traveling.
Amazing.
And this was also pre-COVID as well. I took a year out before I started my specialty training and just like went to the Philippines on my own, went to like a silent yoga retreat, which I kind of think maybe in hindsight was a little bit of a cult, but that's a story for another time.
Oh no, I need to know. You mentioned Philippines and I haven't been. I'm desperate to go to Philippines. I cannot wait. I have enough friends who come from there and the food amazing. I want to go. But cult. Yeah. What happened?
Okay, let me just put it this way. I spent a week there. Yeah. Or was it 2 weeks? I can't remember now. But, there was this guy who was the
leader.
Let's say leader, founder, whatever you want to call it.
No, founder.
And he told us that he had kind of developed this specific type of meditation. Okay. It was very abstract. All right. Okay. But there was lots of really quite young and beautiful yoga teachers from all over the world that were really kind of falling over themselves to talk to him.
Connect
and be around.
With the founder.
Yeah, it was just a strange experience. I left that place and I met this really lovely nurse and we went to see some waterfalls together. Okay. And we were both just like, was that
really just happen?
Yeah.
Oh, interesting. So that always piques my interest. massive tangent.
Yeah.
But no, it's just like, I won't lie, I do love a good conspiracy theory, and I love a good like story or situation like that. And I'm always like, what would I do if I found myself in that situation, or what would I ask? And I'm always like, they'd never get me or whatever else. Whenever I hear about stuff like this, I'm like, what was it like, or what happened? So that was weird little interest. Anywho, so traveling, very good.
Yeah, and you know, I spent time like a few months like working in Uganda, and I went like gorilla trekking, and so I feel very fortunate that, and this is also obviously pre-COVID, that I was able to just really enjoy my freedom and independence, and then obviously then you become a mum, and you can still be obviously all of those things, but I'm very early in my motherhood journey. I've recently graduated from the 2 under 2 club, although I am still in the trenches.
I was about to say, how you doing? How you coping?
Yeah, I'm coping. No, it's tough, obviously. It's hectic. Yeah, the first few months I was a bit shell shocked because you know a toddler under 2 still needs kind of constant surveillance, emotional support and regulation, and then you have a newborn that obviously has constant like physical demands. Yeah. So those first few months were pretty hectic.
Intense. Okay.
Yeah. And it's getting better now.
Yeah. I'm really happy to hear that. Is it obviously I have 1, you've just graduated into the space of having 2. And you've just described, I guess there's a physical demand from the toddler, there's an everything demand from the newborn. My question, which kind of sounds a bit reductive almost, I was going to ask you, were you prepared in any which way to what it was going to be like, or did it still feel just like brand new again, if that makes sense? That's such a weird question.
No, I do know what you're saying. I mean, it's different. Okay, so you've done it once before, so a lot of the things that you worried about before you don't worry about now. Like, you know how to put a nappy on properly, and you sometimes know if it's colic or like if there's signs of tiredness. So there's the element of it's a bit of a less of an emotional load because you have done those things before. Yeah, but it's just the managing of 2 that's really difficult. I mean, I think managing 1 is really hard. There's so many things where you're just like, on the surface, it looks like you just got out of the house, but you know that you've made 1,000 micro decisions before you even left the house. So now add to that another child and another 1,000 micro decisions. By the time it's 10 o'clock, you feel like you've lived a whole life already.
It's very true.
Yeah.
Okay. Did you always know you wanted to be a mum or to have a career in a family as well? Did you know that?
You know what? I always wanted to have a career.
Okay.
That was, always wanted to have a career, to have my own thing, to do my own thing. But I also really strongly knew that I always wanted to be a mum. Okay. To the extent that I felt if I hadn't met somebody that I wanted to have a family with, I probably would have pursued it on my own.
Okay.
And that's something I see more and more each day now, is people pursuing solo motherhood by choice. Because I think some people want to have children in the context of a family. Yeah. And I obviously did want that, but I wanted to be a mother independent of that as well. So yes is the answer to the question.
No, I hear you. Okay, no, that's really, really good to know. As a fertility doctor, you see things, I guess, that most women don't at all. Like, what's the biggest misconception about fertility, do you think?
There are so many. Like, where do I even begin? But I will start with one of the biggest issues, which is, I think, that as we are growing up, like in school, I don't know if you remember the sex education that you had in school.
Like, I do. It was laughable. Yeah. It was ridiculous.
And it was also like boys and girls would go into separate rooms. That's what happened at my primary school.
Oh, primary school. I didn't have it in primary school. I had it in high school.
I think that was about like periods and things like that.
Oh my gosh. In primary school, I think we vaguely touched on periods. I can vaguely remember that just because I knew there were maybe a couple of girls who had started. Yeah. And I think I'm actually giving I love my primary school, but I think I'm giving it grace by saying that we did. I'm not even sure if we did.
Yeah, really. I mean, I guess a lot don't, but the majority of sex education in general education is basically how to not get pregnant.
Yes,
so correct. Contraception. Yep. Consent.
Oh, we didn't have that.
Yeah. Okay. Yeah. So consent if you're lucky, which is crazy.
That's crazy. But yeah,
but basically, it's all about how to not get pregnant.
How to not get pregnant. I think, what types of contraception? Yes,
consent,
STIs, yeah. I think did we see some images of STIs or what it can look like on the skin?
Just to scare you, yeah.
Just to scare, I think we had that. I think that's about it.
Yeah.
Yeah.
That tracks.
Our teacher was really funny. I don't even want to get him in trouble, but he was also really funny. But he was like, a little bit like, ooh, like, all this stuff is super scary, but you have a great time kind of vibe. So he was very tongue-in-cheek.
Oh, okay.
But it was cool. I think we were smart enough to like, I'm not going to say his name because I absolutely adore him as a teacher. He was brilliant. But he was really funny and a bit like to us, which was quite cutesy. Anyway.
But the issue with that is if somebody spends your whole life just telling you how to not get pregnant and just use contraception, you assume that when you come to the point of wanting to get pregnant, you just take the contraception away and you'll be pregnant.
Yeah.
So it's a huge shock. And I feel like it's a little bit of gaslighting that we're not actually told it's not that easy to get pregnant. You know, like the chance of you actually getting pregnant in 1 month, if everything is correct, is like 20%. So you're far more likely not to get pregnant in that month. And I have friends, and I'll say even my own experience, like who will start trying and they'll say, but I kind of expected it just to happen on the first go. Or 3 or 4 months in, they're like, what's going on? It hasn't happened yet. And I'm like, no, you need to be budgeting for 12 months of trying at the minimum. And so by the time that you realize, okay, I want a baby, I'm ready for a baby, you're ready for the baby now.
Yeah,
You're not ready to be trying for a year, to be pregnant for 10 months, to have that baby in your arm maybe in 2 or 3 years' time, you know? But I mean, there are also so many other misconceptions which I can
go on about. No, even what you've just said, just highlighting the length of time, that is something that surprised me. I kind of assumed because I'm starting older, I knew that it could take some time, but I didn't realize how much I didn't know, and I didn't realize the maths that's required, and I didn't realize even if you're doing everything right, the chances that you have in that week where you're ovulating, but it's actually the 3 days, and in those 3 days is the 1 day, and at the right time, I didn't realize all of those things, and my first thought was like, why weren't we told this? Like nobody told us this is what it could be like. That was insanity. Like, what do you think? It also kind of just made me think about what do women think they know about their bodies that isn't actually true? If that makes sense.
Say it again, sorry.
So what do women think they know about their bodies that isn't actually true? So for instance, pulling from what we just talked about, again, once the contraception is off and I'm healthy, he's healthy, okay, we're good to go. So that's one thing I thought would be the case in having kids, but that's not actually correct, not actually true.
Yeah, I mean, I think a lot of, and we'll talk about men as well, because this is not just a women's issue, but a lot of the time women don't know when their fertile window is. And okay, look, if you want to have sex every day of the month, you'll cover your fertile window, or even every other day. But for most people, that's not going to be the case, or sometimes people work away, it's not always feasible. But understanding when that fertile window is really important, because if you miss it 1 month, that's it for that month. So okay, more of us are using apps now.
Yes.
But a lot of the apps work on sort of a standard 28-day cycle.
Got you.
People have different cycle lengths. So the important thing is that you actually understand what your body is doing. And start, making a note in a calendar or an app. I don't think personally that you need to pay for these things. I think a pen and paper is also fine. But know when your period starts. Can you look at a calendar and roughly know when your next period is coming? Because if you have no idea, then there's a good chance that you have irregular periods.
Okay.
So an average cycle is about 28 to 35 days. How long is your cycle? You can look for other things, like you can use ovulation tests. You can use these basal body temperature things. You can look at your cervical mucus, which around the time that you're ovulating becomes like sort of mucusy, like egg white. You can use all of these things to work out your fertile window. You don't have to do them every month, but when you understand roughly, you will then know. And then you need to time intercourse for at least a couple of days before you ovulate. Because if you wait to the day that you ovulate, you might miss it, because the egg, once it's released, is only around for 12 to 24 hours. Sperm can survive for a few days. So what you want is to start having sex a day or two before you're ovulating, so the sperm is like ready and waiting there to meet the egg. Yeah.
When I discovered that absolutely blew my mind. I was like, wait, what?
Yeah.
I had absolutely no idea. I didn't know that once the egg is, that is the window.
Yeah.
I didn't realize that. I didn't realize that it was smarter to, as you were saying, have sex before and during whatever you're doing. But like, you have to just, however you're going to prime yourself, be primed in that space.
Yeah.
You mentioned apps briefly. When we were trying, it wasn't, I think, I think when we decided, okay, we're going to do this, I think 6 months in, we were like, oh, okay. I was like, well, I figured it might take some time. And I happened to have like a whole body checkup with a doctor. And I told her what we're doing. And she was like, don't use apps, use the ovulation test or sticks, because that's every day at a certain time in the morning, you're checking your hormone levels in your body. And when I had that advice, by the next month, we were pregnant. So that was really interesting to see. And one thing that really annoyed her was just like, I guess, how much we're relying on apps and then just not the best ways to count or measure these things. But everyone thinks they're doing all the right things because they're putting in the information. Yeah. They're consistent with that. So it's going to tell you what the outcome is. But there was just this idea where you kind of need to, I guess, almost as, it's going to sound really weird, but you need to kind of humanize this whole experience. Like you have to be really tactile or just really physical with yourself to kind of get the answers you're looking for, rather than relying on this app that doesn't know you, essentially. So what do you think about apps? How do you feel about them?
Well, the thing is, the app is just another way of gathering information. I wouldn't depend solely on an app. So you can use a combination of things. And you don't need to do all of them every month. You can use the app, you can use the ovulation test, you can use the basal body temperature thing, you can look at your cervical mucus. You can try and just notice. Some people actually feel when they ovulate as well.
Yes.
So you can use a combination of things to tell you about your fertile window. The more you do that, the more you understand and you'll be able to predict. I do think if you just plug it into an app and nothing else, you run the risk of maybe missing some information or slightly getting it wrong. I'm not against apps. I think they can be useful. I would kind of probably use a combination of things.
Okay.
It's all about gathering information just to understand your cycle.
Yeah, okay, that's really useful. Do you think women are, I know the answer to this, I think, but do you think women are being given information early enough?
Absolutely not. Yeah, absolutely not. And this is one of the difficult things. Like if you look back historically, well, even just biologically, the most fertile we are is when we're about 19 and a half years old. Which is crazy, right? Like
that is nuts.
Yeah. I'm also not advocating for anyone to have a teenage pregnancy. If you want to, then anyway. Let me not get into that. But the reality is that most of us are not trying to get pregnant.
Yeah.
Okay. And when you look back historically, there is a direct correlation between like women's level of education and delaying childbearing. Because we're also pursuing other interests in life, right? That we are delaying childbearing. So historically, people would have maybe started having children in their late teens until like mid-30s, and then have like quite a long reproductive life.
Got you. Okay.
Now it's very compressed, right?
Yeah.
A lot of people, I mean, especially if you're in a metropolitan city like London, won't be starting until sometimes not till their mid or late 30s. So that window of opportunity is very truncated. So if you don't have that information, and only at the point where you come to start trying in your mid to late 30s or even your early 40s, it just becomes much more difficult. If you have that information earlier on, you can just do a bit more forward planning. And I don't think it's ever too early to talk about these things.
Another question, I guess. If every woman could know 3 things about her fertility in her 20s, what would they be? Okay,
one thing I would love for all women to know or to do is just, number one, treat your menstrual cycle like another kind of vital sign. Okay. So think about what it's telling you, okay? So if you, as I say, number one, is your period regular? Can you look at a calendar and roughly know when your next period is? If yes, that's fine. If no, it might be that you have irregular periods, and that might point to hormonal imbalances or things like PCOS. Then are your periods really painful? I mean, okay, periods are not fun, and sometimes the first day is a bit more painful, but if your periods are so painful that you are cancelling social plans, you can't go to the office, the pain is not managed by things like paracetamol and ibuprofen, that's probably a bit too painful. And
Okay.
you might want to be thinking about conditions like endometriosis, adenomyosis.
Okay.
And then, how heavy is your period? If you are flooding through your sanitary products, if you're having to double up using tampons and pads, if you're passing clots, again, if you're becoming anemic, if you're having symptoms like dizziness and lightheadedness from your period, that's probably too much as well. And then we're thinking about things like fibroids and other various conditions.
Yeah.
So have a look at your period. If it's not quote unquote normal, then see your doctor and have some investigations. And that kind of brings me to my second point. And this is not really in the guidelines, I'll be honest, but I do really think this is important. I think women in their 20s or their 30s, just as soon as you can, really, I think you should have a pelvic ultrasound.
Okay.
Because we get so much information from a scan. It's an internal scan, but it's not painful. And we can assess so much. Like, we can look at your uterus, we look at the shape, the size. Do you have fibroids? Do you have signs of endometriosis? Do you have adenomyosis? We look at your ovaries. Are there cysts? We also get an idea of your egg reserve from the number of follicles that we can see.
Okay.
If there's anything abnormal, it's really important to know about that, because one of the things that is difficult for me as a fertility doctor is people coming to see me and we're talking about fertility and getting pregnant and stuff, and I'm doing the scan and I have to explain that they have these conditions they had no idea about. They're not really there to talk about. They're there to talk about having a baby.
Yeah.
And now I'm saying, okay, but yes, you also have, this multifibroid. You might need an operation.
Yeah.
It's quite a lot to take on.
Yeah.
So looking at your period, ideally having a scan, and just that thing about understanding your fertile window and looking at things holistically.
With what you just mentioned, people come to see you at the point where they are babies is the goal. That's the target. When you're having to highlight any other potential issues, or have they done certain checks or certain things like that, how do you find that? How do you juggle that? Because you're not delaying them. You're making sure that they have everything that they need. But I guess there's an element of disappointment maybe that you have to deal with, like maybe daily or constantly when you're at work.
Yeah.
Is that like?
It's honestly, it's difficult. Like, I'm somebody who I sometimes have 45 minutes to an hour appointment. I will talk the whole time.
Yeah.
And when people when I'm doing their scan, I actually didn't realize that this is not everybody's experience.
Okay.
My default is I will explain everything to you that I'm seeing on the scan.
Amazing.
I had a woman who cried. She said no one's ever done this before,
wow.
which really shocked me, because I was like, well, why not? Like, we're here. Anyway, that's another. But yeah, so I will talk through everything I'm seeing. And then I'll take the time, obviously, afterwards to draw some pictures, explain the context, explain what that means. But it is a real challenge, because it does also pose a big delay, and it's really hard for Black women because we know fibroids, first of all, are really common, but we do know that Black women are much more likely to have fibroids, and they're more likely to start earlier and be more severe. So number one, we often see Black women come later. They present later to fertility services, and that's backed up by the literature.
Okay.
On average, they say it's like, 1 or 2 years. It feels to me like it's later, but I will go with what the literature says. But they come later. And then obviously, if there are things like fibroids, they are oftentimes more severe.
Yeah.
Now, just to caveat, not everybody that has fibroids, I mean, lots of people have fibroids and don't even know about them.
Yep.
So that's the first thing to say. We pick them up because we're scanning anyway.
That's right. Yeah.
But some people, if they are really severe, or depending on the size or the location, they will need an operation before getting pregnant. That will be recommended. And if that's the case, then actually, if you go the NHS route, you could be waiting 6 to 12 months for an appointment.
Yeah.
Then you have to wait another several months for the surgery. Then they're going to tell you that, well, you need to wait X amount of months to recover.
Yeah.
So you can see if you're coming later already.
Yeah.
And now we're adding 2 years to your timeline. That can be really devastating, actually.
Of course, yeah. No, I didn't know I had fibroids. I've got 3. I had two small ones, and then there was one that was growing with baby.
Yeah.
And I found out when we had the first scan. Then they talked us through that and what that was like, and then in terms of delivery, it became a thing of like, okay, maybe these are the options you may have to have. There might be an emergency C-section. You might lose a lot of blood, or so then they explained possibilities and what could potentially happen. But I didn't know any of those things. I had no reason to check or to think to check or to have the pelvic scan or anything like that. And I think, again, if I was armed with that information, those are steps that we would have taken, because my periods are a certain way, like what you described is what they are.
Yeah.
And if I'd known that,
Yeah.
if that information was readily available, sure, people would take the right steps, what have
Yeah.
you. So that's really, really, really good to know. I don't know if you're able to answer this at all, but do you know why it's so prevalent in Black women at all, or not? I know women, people get them, women get them, but why so?
Yeah, like I say, it's really common.
Yeah.
So lots and lots of women have them without ever having any symptoms, without knowing. We don't exactly know why they start earlier and they're more severe in Black women. There's lots of hypotheses. There was some research, I think I just heard about a couple of days ago, about, maternal mortality being worse for Black women, and trying to understand actually, but why why is it worse in terms of how does this actually translate into biologically, like what's happening? And there's interesting research coming out about it, but the truth is we don't really know.
Yeah, I know it's not an area that doesn't have a lot of research. Is that correct to say? I worked in a project, but I was there as an actor, and I think there's this. So annoying. So I'm absolutely going to ruin everybody who works on this project. But either way, this is like, we really want to make sure we've got funding for this, and we're trying to push for more eyes and more work and more hands on this space to understand fibroids and everything that happens there. I'm going to have to tag and link everyone in this conversation later. But it was great to hear that there seems to be forward motion in that space.
There is, and there are lots of people and people from the RCOG, like Dr. Christina Ketchy, who's doing a lot of work on this. We definitely need more funding. I mean, women's health overall gets less than 1% of public health funding. So you can see that's the whole of women's health, let alone fibroids. It's a huge issue. Yeah. It's a huge issue.
Sidestepping from work for a moment, how did you experience motherhood compared to what you knew medically? What was that like for you?
That's an interesting question. I had a very medicalized view of pregnancy. So it's kind of funny, like the first time I had a positive pregnancy test, I basically was like, I can't get invested in this pregnancy until I know that, I've had a scan, I know there's a heartbeat. I didn't even buy anything for my first one until I was like 36 weeks pregnant. Because mentally I was like, I'd medicalized it so much. You also have a skewed view because, like a low risk pregnancy where you have, nothing comes up during the pregnancy, you may never see a doctor. So for us to get involved, it's usually because something is not going to plan or there's something high risk. So you end up with quite a skewed view of what's normal.
Okay.
So I had a very medicalized view of pregnancy. But it was fine. It was all good. It was thankfully all straightforward.
Yeah.
The delivery was fine. I had an emergency C-section the first time and then I had a planned one the second time, which was really nice. Again, I wasn't married to any type of like delivery or anything. I was like, as long as I'm fine and baby's fine, then we'll be okay.
Okay.
But being a doctor did not prepare me in any way for motherhood, just to be clear. Because people would ask me and I'm like, no, my job was like delivering the baby. And once the baby was out, I didn't know what to do.
Because I was going to ask you, did being a doctor prepare you, or did it surprise you in any way?
It didn't prepare me at all.
Got it. Okay. Yeah. Well, it's good to know. It's like everyone is literally in the same boat, no matter what it is.
I was absolutely shell-shocked. Yeah.
Yay, motherhood. Fantastic. Like, how do you hold both identities, that being a doctor and a mum, in the same space? What is that like?
Yeah. One thing I will say, which is something I've kind of grappled with recently, is that I always thought, because I really wanted to be a mum, that I would enjoy the kind of staying at home, like the maternity leave part of things.
Understood, yeah.
I didn't really enjoy it.
Okay.
I find it really mentally challenging. It's easier for me to be at work, for sure.
I get it.
And I feel like there's a little bit of guilt, a little bit of shame about saying that, because it's almost inferring like you don't want to be with your kids. Like that's definitely not the case. Yeah. And you always feel like you have to caveat, but I love my kids. You know?
Yeah.
And we're like, we know everyone loves their kids.
Exactly, we do.
But I do think, and I think we sometimes kind of sold this really self-sacrificial or like martyrdom image of motherhood.
Yeah.
I really feel like you do have to be a whole person and maintain your interests. I'm not saying everyone has to work. That's not what I'm saying at all. But you're still a person, right, with interests and hobbies and whatever it is.
Yeah.
And you have to fill your own cup, because that's the cup you're pouring from.
Yes, it's very true. And if you don't, you're pouring from an empty cup, and that's only going to last so long.
Yeah.
And then now...
And we're all suffering.
There we go. Yeah. And you don't get time off per se because you are constantly on the go. So no, like completely hear you. In terms of, I guess, the parts that you found challenging, and as you said, I guess you said it was easier being at work. Is it because, again, you know the parameters of work, isn't it? You know pretty much, right, what's happening, what to do, what your day-to-day looks like. So was it the unknown about motherhood that kind of really got you, or there's a monotony to it as well? Was it part of that as well?
That's part of it, for sure. It's like the... especially, I mean, don't get me wrong, like it's different, and I've experienced the different parts of it. But at the moment with a very young baby, it's a lot of just kind of menial tasks. You're just kind of on a loop, right? Yeah. The baby sleeps, they wake up.
Yeah, that's true.
You feed, you change the nappy, you know. So that's a bit of like a boring loop. Yeah. Let's be real. The toddler needs more emotional regulation, which can be more exhausting, but they also give you more back, right? Yeah. And that's also one of the great things about motherhood, is that you know that there's more and kind of better to come.
Yeah. Understood.
So yeah, I found that hard. I joked to my husband the other day that me trying to do my daughter's hair, I was like, I find it easier to do a C-section than to do this girl's hair. Because the moves that I'm doing, my God.
Just to try and get them still. I just want to get the part in straight. If I can get the part in straight, then I've succeeded. No, I hear you. That's absolutely hilarious. That's crazy.
And it's also like the mental stimulation as well of being with other adults. And I'm not saying that because I'm a doctor. It's not that at all. It's like just talking to other adults.
Yeah. Did you find that people expected you to have it figured out because of your professional, your role, your job that you do? Can't speak English. I
don't know, actually. You know, like when you go to all these baby groups and play groups and stuff, I never spoke about work.
Okay. Yeah. Okay, cool.
And that's refreshing in a way, kind of just like shed that identity and just talk about, you know, they're crawling or the poo or whatever. Yeah. So yeah, in a way, I tried to kind of leave that behind. Also because I didn't want people to ask me medical questions.
You're like, I'm here like you, but I don't know what I'm doing.
I really don't know what I'm doing, so don't ask me any questions. Yeah.
No, completely understood. I know you've touched on, like, I guess, various different parts of motherhood, but is there an area that you still feel like you're figuring out?
I'm still figuring out the whole thing. Day by day, you know?
Fair enough.
You're just always trying to... I mean, you're just trying not to mess up your child, right?
Yeah, it's true. No,
I kind of accepted that we will traumatize them in some way.
Me too. You know? That's it.
It's just, trying to minimize that.
That's it. Now that we have all the words and the dialogue and the language to explain all the things and all the feelings, I'm not saying it's a bad thing, or sometimes I'm like, oh my goodness, like my mum did not have time for any of these things. You know? Now that we know this, I know my hope is that whatever damage I'm going to do, please don't make any damage, whatever damage we're going to do, it'll be less than. Yeah. So hopefully we're just going to continue to do less than. But I'm also hyper aware that we are people, we are human, we are all just figuring it out. We're all learning on the job. We are still learning. Yeah. And so there will be mistakes, and it's just knowing how to spot them, recover from them, and repair them as best as you can. Yeah. You know, that's all that you can do. That's it. And it definitely made me look at my mum differently. I'm very thankful that we have quite an open relationship, a very honest relationship. My mum has no filter. And I talk about it all the time, and you know this. No filter. So my experiences with her are very different to some of my friends, but I'm grateful for those conversations and the fact that that's what our relationship is like. But looking back, just thinking about her as a mum, navigating 5 kids, 5 different personalities, I get it. Yeah. I understand why certain choices were made and whether I thought they were right or wrong. Like, I completely understand it. And like, even in those moments where I remember her just in her bedroom by herself, and I'm like, but she's not with us. Like, Mom, come and sit with us. She was trying to regulate. Like, that's 5 kids. I need some space. So like, it definitely made me look and see that very differently and just understand, you know.
Yeah.
Hopefully I'll just do less damage.
Yeah.
Fingers crossed.
And you're always trying to, this is one thing I'm always trying to like parent in response to the needs of my child rather than the needs of my inner child. You know?
Nice.
I don't want to be like, well, this thing happened to me, so I must do it like this way, or I must never do that thing. You know, because then you're kind of parenting yourself rather than your actual child.
That's
and I'm
true.
saying this as somebody who has really young children, and obviously that's going to change and become more complex as they get older, and they're probably going to trigger me in ways as well. But yeah, we do have more language, and I'm sure, like I said to my mum, you know, she says things to me like when they were younger, oh, but like, you know, let them cry, it's good for their lungs. I was like, I don't know about that, mum. I think the lungs are fine.
I'm a doctor and I can say.
No, but then, and then, you know, you learn new things, or like, you know, I'll explain to her, I say now with a 2-year-old, mum, we praise the action, not the child.
Okay.
You know, so we praise like the effort.
Nice.
We say, you know, thank you for doing, you know, thank you for being helpful, thank you for being kind, like not trying to emphasize being like cute or clever too much.
Yeah.
And she's like, oh, we didn't know these things with you guys. And I'm like, yeah, look, well, you know, we can only do better when we know better. But
this is so random. I'm having lots of random moments with you, but I'm so glad that you said that, because oddly, I've noticed with Zena, I think we definitely would praise the action and not the child. I've never actually heard that as a phrase like that. That's what we do at home, but lately we're definitely noticing she's starting to say certain things like, I'm a good girl, or I'm a this, whatever else. And I hadn't noticed that change in her language, because she's never spoken about herself like that before. It was always whatever she's done, the action or the helpfulness of this or the kindness of this or whatever, we'd always highlight that. But I'd noticed that change, and I've been trying to put my finger on what it is that's different. So it's like you're receiving information from somewhere that's kind of highlighting or putting an emphasis in the space that we didn't used to. So that's just like, oh yeah, that's my mind. Very random tangent, but
well, there's always going to be outside influences, right? But yeah, you can only. I think the most important thing is what's happening in the home.
Yeah, it's true. But that's just like, oh yeah, that's been bugging me. Thank you for putting that phrase in my head. On the to-do list of things to look at, never mind. Anyway, back to you. Has motherhood changed your ambition or sharpened it?
You know what I will say? I kind of expected. I was like, I need to do as much as I can before I have kids, because once I have kids, my ambition will be like gone. Okay. The thing is, I also don't think you can ever know how you'll feel until the time comes, and there's no right or wrong. It's only about what's right for you. I actually feel like it's a bit sharpened it a little bit for me, because there's parts of me that feels like the time that I spend away from them, I have to make worthwhile. Yes. But also for myself, like I enjoy my work and I want to do it, and I think it's important to have your own thing as well. Yeah. It doesn't have to be work, but for me, it is. Yeah.
Have you, I don't know if you've had this moment, but have you ever felt like you've had to choose between career progression and motherhood? I don't know if you have at this.
Yeah. I mean, I'm doing it right now, right?
Yeah.
Again, so something I was talking about the other day, you know, the energy I feel like that it takes to gain momentum in your career, to then suddenly halt and then build that momentum up again. And now for me, I'm doing it the second time in 2 years. So for me, it feels like, you know, like a car, if you were just kind of cruising along, but you have to expend more energy if you brake suddenly and then you have to rev up again and brake suddenly, you know, that takes a lot of mental and physical effort for me. That's been challenging. I've taken 2 years, you know, a bit less away from work. I mean, it's everything has. I'm still plugging away, but everything is slowed down. That's the reality of it.
With that in mind, what does a real day look like for you? Like, what does a day in a life for you? What is that like?
Well, it depends, because right now I'm on maternity leave.
Yeah, okay.
But a normal day, I would be, you know, dropping my daughter off at nursery, then rushing to get the train to get to the clinic. To see my first patient. I might spend each day is a little bit different. I might spend like a morning doing all scans, or doing a clinic, or being in theatre doing things like egg collections or embryo transfers. Usually till around 5:30. then I'm rushing home to try and get back for bath time. Spending a little bit of time with the girls and then putting them to bed and spending a bit of time decompressing and then going to bed myself.
Bless you. I guess in those moments, or in a typical kind of day to day, like where do you feel the most stretched? Is it the rushing on either side of the day, like getting to work and then trying to get home? Are those the worst moments?
I would say yes, and a lot of the time it's like the end of the day where you kind of finished your work, but like people are still milling around, and you're in your head you're thinking like, oh, if I don't get the next train, I'm gonna have 15 minutes less with my child before they go to bed, and it's that like wanting to be seen at work, but also wanting to be home, be with your kids, and I find that bit really hard actually.
I think that's the not the balance. I think that's the worst part of it all. I think regardless of your industry, as you said, people are milling about, and ordinarily that might have been time that you might have used to, I don't know, talk about the day or network or just do other things that are maybe more social, but they elevate your career or you in some way, shape or form, and now you're having to kind of sacrifice that or decide if it's necessary on that particular day or what have you. So that's definitely something that people tend to highlight quite a bit actually. That for sure.
And to be honest, a lot of the time I would I'd be like, I've done my work, I'm gonna go because I've got to see my kid. And I think I worried a lot that would be perceived as not being like committed or whatever. But I worked so hard when I was there during the day that actually I don't think it really did. I'm hoping it didn't, but
no, I get that. I guess maybe moving more into a work space, fertility space again. Do you think society has sold women a slightly incomplete picture of what fertility is, what it looks like, and what timing looks like as well, if you're someone who wants to conceive?
Yeah, well, I mean, I think we're just failing to give a lot of information. And then there are these ideas that, okay, well, we can delay I think a lot of people feel that if they have healthy lifestyles, then they won't have issues with fertility. That's a difficult one as well, because I see a lot of, and don't get me wrong, fertility declines for men as well.
Yes.
Not in the same way as for women, but I do see a lot of women who, live really good lifestyles. They exercise, they eat well, they don't smoke or drink. And then they come to see you like in their late 30s, early 40s, and you're saying, well, look, I'm not saying it's impossible at all, but these are the chances and this is what we're going to have to do, etc. And they're quite shocked. But the reality is no matter how good your lifestyle is, you actually still can't get around that age-related decline in fertility.
Got you.
Because women, we're born with all of our eggs, and they kind of just decline over the course of our lifetime. And for men, they do decline as well. And there are studies as well that show that, especially fathers over the age of 45, their children have higher risks of things like autism, bipolar disease, schizophrenia. It's not to say that older fathers can't have healthy children. Of course they can. So can older mothers. But it's just that for so long we've just sort of made it a women's issue that, people are always a bit surprised to hear that men have a biological clock.
Yeah, understood. If that's not something, again, unless you're in it and unless you're in that stage of life and you're trying to proceed with having a child, I guess you're not going to be privy to certain bits of information, and if that information isn't being trickled down to all of us, the rest of us, again, you are going to be surprised to hear, oh, men also have these types of issues, and you were so sure, or we've already been told that it's more female based or more women based and stuff. So
totally. I did a consultation and I explained that the sperm, I was explaining like the things that we looked at with the sperm, and the sperm was quite poor quality, and the male partner sort of like suddenly looked up and went, are you talking about me? And I was like, oh yeah, like I'm talking about the semen analysis. And he was like, but what about her? Doesn't she have any sperm? And I was like, no sir, that's so yeah. But the thing is, men really have to do their part, because as I said, women, we're born with all of our eggs, but men are producing sperm every single day. And there are things that you can do to improve your sperm quality if that, and they're kind of easy wins as well. Like, number one, smoking, okay, and that's everything. So cigarettes, vaping, cannabis is really, really bad for sperm, actually. It really slows it down. You can stop those. And alcohol as well, especially binge drinking.
Okay.
And men also, the testicles are outside of the body to be kept cool. So you don't want to be exposing them to heat constantly. So if you're having daily really hot baths, or you go to the gym and you go to the sauna, regularly, or if you're working from home and you're sitting with a hot laptop on your lap all day, all of those things can be affecting your sperm quality.
Interesting.
And for men, so sperm has like a 3-month life cycle. From the day it's produced to the day it's ejaculated is about 3 months.
Okay.
So if you make lifestyle changes now, in 3 months' time, you could...
Fresh new batch.
Yeah, you could dramatically... Yeah. And it's not just about getting pregnant, it's also the health of the pregnancy.
Yeah.
Again, it shouldn't be surprising that, sperm impacts the chance of getting pregnant and the health of the pregnancy. But again, because we've focused for so long on this being a women's problem...
Yeah.
We've left men out of the picture.
Yeah. And I think I only learnt that not the other day, but it may as well have been the other day, like how much it really contributes to the health of the pregnancy and stuff as well. Yeah. Again, I felt like I was too old to have known that. I should have known that a lot earlier in life. But yeah, no, that's really, really
none of us were taught, right?
No.
I'm telling you this as a fertility doctor. It's not, I wouldn't know this information otherwise.
Yeah, we can. So, oh my God, we've got so much work to do as a society. Jesus Christ. Oh my goodness, that's a whole other conversation for another day. That's another podcast. But anyway, no, that's really, really great to know. And it's great to know that, yes, this whole situation takes two, however that two is going to look like. But we've all got a part to play in making sure if you're a couple or a person who does want to have a child, like we've got stuff to do from our health perspective before we can even consider anything else happening, if that makes sense.
Yeah.
So that's really, really good to highlight.
For sure.
Weird question, perhaps, but what conversations are we still avoiding as women when it comes to our fertility health?
You know what? One of the things I think is really important for women to be asking themselves, everyone to be asking themselves, but I guess most of your listeners are women, right? Is really about family planning.
Okay.
I think a lot of the time we put off the difficult conversations, especially if we feel like maybe you're a single woman and you want to have a child, but maybe you haven't met.
Yeah.
I'm this is a very heteronormative way of putting it, but if you haven't met a man that you want to have a child with, I think there's a lack of probably emotionally mature men out there.
I hear that.
So you kind of just like put the conversation off. But I will say, if it's really important for you to have a child, either with a partner or with a donor, you can do it on your own. Like, these are still conversations to be had. So I think people should really be sitting down with themselves and with a partner if they have one and talking about what your future looks like.
Yeah.
Is having a family and having a child a really important part of your future? You don't necessarily have to have a biological child. There's also other ways of having children. But it's about having the conversations now so that you can make proactive steps.
Yeah.
Otherwise, what's happening is that we're just waiting and to the point where it's now really difficult. All the choice is taken from us completely. And even psychologically, if somebody says to you, do you want this thing? And you're like, I have thought about it. No, I'm good. Versus, oh, sorry, you can't have it. Anyway, it's too late now. Psychologically, that's very different.
Yeah. Understood.
So I would say just sit down with yourself, with your partner, and have some serious conversations about what's important for your future.
Fair enough. That's a very, very good
And there's
advice.
lots of different ways to have a family, like you can be a solo mother by choice, same-sex couples, donor conception, surrogacy, like all of the ways that we have been shown, and like the nuclear family, there are other ways to have a family.
Yeah.
And so even if you feel like, no, I'm not in the position, have the conversations.
Yeah, that's really, really just good. That's good advice, and that's also just good life advice that you can apply to so many parts of your space. So, no, that's brilliant. Touching on that a little bit, do you think are we leaving motherhood too late? Do you think? Like, are people afraid to just say that? I don't know. I know we're having kids, having kids later.
Yeah.
It seems that's the societal shift or cultural shift. Are we leaving it too late?
Well, look, if you ask me from a purely biological perspective, then leaving it later makes it harder. But I don't think necessarily we're leaving it too late in the sense that, like, we're just living our lives and we're pursuing other things. Yeah. But we're maybe not having the conversations or planning ahead early enough.
Yeah.
Because if you said to yourself, you know, I want to have a family, but I'm not going to be in the position to do that until X amount of years. But instead of just sort of burying your head in the sand, if you had the conversation with yourself, with your partner, you went to a clinic, you had a scan, I've got fibroids, I might need to have surgery, I'm going to push this conversation forward by 2 years, or my periods are really irregular, let me come off my pill 12 months earlier, let me see what my cycles are like. If you started planning and making provisions earlier, then I don't think we're leaving motherhood too late. I think we're leaving the conversation too late.
Nice, okay. That makes sense. Okay. I was going to ask you a whole bunch of stuff, but you just answered all of them. I was like, oh, she's very good at this stuff, guys. She's very good.
One thing I will say as well, I don't want women in particular to listen to conversations like this and feel worried or pressured. Because I think there is also this feeling that we're maybe like scaremongering or over-educating. But I think the problem is that we've just basically had like nothing for so long. So now it's like to kind of almost level the playing field a bit. It seems like we're doing a bit too much.
Understood.
You know? But I really do just want people to come away feeling a bit more empowered to be able to access the right information. And the other thing you have to remember is that the online space it's a wild west, right?
Yes, it is.
So where there is a lack of reliable and trusted information, people fill the gap. And a lot of the time people fill the gap with affiliate links and marketing techniques, and there's the amount of stuff I've seen around fertility is insane. You know, like pills and teas to boost your egg reserve. And that doesn't even biologically make any sense because we're born with all of the eggs that we are going to make. But you know, people and having a child is one of the deepest desires that a person can have. So now if you take that and you put a bit of clever marketing with it, okay, it's like, you know, it's a payday for a lot of people. So I would just say be very careful with the information that you consume. I'm very clear that the stuff that I share is, and also, you know, I'm doing this on a daily basis. This is my job. I see a lot of people talk about fertility, but maybe are not looking after people in this space on a daily basis, and it honestly really frustrates me because I have seen people going through it and they bring me stuff that they see online.
Of course.
And it's there. People are being exploited essentially.
And I guess anyone who's in your position, that the work that you're doing or the facts that you're trying to share, backed by research, backed by science, etc., you have that battle daily, all the time, as you said.
And a lot of the time I feel I'm losing. You know, I'm still going to be there shouting.
Flag. Shouting the truth. But But
the videos I see that, you know, and people send them to me as well, the ones that really gain a lot of traction. I can't compete with, you know, millions of people on these videos saying things like, the female biological clock has been debunked. You know, I had people saying to me, oh, I'm not going to go for my egg freezing anymore because have you seen this video? And I'm like, no, this is real.
My actual heart. No.
It's really difficult. And it was because now that we have things like ChatGPT, like people can take certain bits of information and it sounds fairly credible. But the problem is it completely lacks context and they don't understand the real world meaning of it.
Oh my goodness.
It's really just a challenge.
So I'm super grateful that you're doing the work and you're using your platform to speak as much truth and honesty and research-based, science-based information that goes alongside. My English is failing me right now, but I'm so glad you're just chatting the truth, isn't it? You're not chatting shit to people, which is great. That's what I'm trying to say in a very professional manner, which is just fine. You don't have to be terribly. But no, so I'm really grateful for platforms like that you're literally, you are really like just a clear voice in a room full of noise at times. And I like that there seems to be a shift. I think it's slow, but there is a shift of people really trying to be very intentional about what they're consuming, especially when it's in spaces like fertility or having children or having a home or whatever space you're trying to be more intentional about. So your voice it's not lost on us, if that makes sense.
Thank you.
So please go on every podcast possible. There's 1,000 of them. Keep shouting, keep chatting. To wrap up though, I wanted to do a quick fire session with you.
Okay.
All right. Hopefully I won't choke any more on that. But one word to describe motherhood.
Ooh, expansive.
Oh, nice. That's a great word. Oh, yeah, brilliant. Okay. Something women panic about, but they shouldn't.
Ooh, fertility. Caveat, because panic is not helpful. Let's just get information and make decisions.
Yeah. All right, nice. I'll take that. One thing every woman should do for her future self. Self, even, that's bad English.
Yeah. Understand your menstrual cycle, and if it's feasible, have a pelvic ultrasound.
Nice. And then lastly, mum guilt or mum confidence. Where are you today?
Mum confidence. I've had a great time being here with you and like sharing information.
Yeah.
And I know that in turn, like that also makes me a better mum.
Yeah, amazing. Nagla, thank you so much for your time today. It's been amazing, genuinely just hearing you talk about the work that you do and why you do it and how you came into it and just how you are trying to educate people throughout this space. So thank you so much.
Thank you. Thank you for having me.
Guys, thank you so much for listening to this episode of Milk Mummies. If this conversation resonated with you, please share it with someone else who might need to hear it. As always, thank you for your time. Feel free to share, like, follow, subscribe, all of that good stuff, and I will see you on the next one.